Worldwide, the Omicron variant has produced a fairly dramatic pattern of illness, starting with a steep climb in cases, followed by an equally steep decline. Ohio is experiencing the same pattern repeated in other parts of the nation and the world as this highly contagious COVID-19 Omicron variant continues to make its way through the state. Now, Omicron first arrived in Ohio on the heels of the Delta variant, with its impacts felt first in Northeast Ohio back in December. It didn't take long for Cuyahoga County to soar to the very top of Ohio's weekly case rates per 100,000 residents in mid-December, with more than 1,200 cases per 100,000 residents. Within just 1 week, that number had doubled to more than 2,500 cases per 100,000 and then peaked at over 3,000 cases per 100,000 1 week later. Now, as we enter February, that number has plummeted in Cuyahoga County to 268 cases per 100,000. And Cuyahoga County now has the lowest cases per capita of all of Ohio's 88 counties. This dramatic climb and subsequent fall illustrates the rapid cycle of Omicron. As these cases skyrocketed from mid-December through much of January, record numbers of people headed to the hospital for testing or treatment, crowding emergency rooms and filling our hospitals. Hospitalizations reached a pandemic high of 6,749 patients on January 10th. And thankfully, that number has been falling daily ever since, now at 3,464, which is a 48% drop. Still, a very high and very concerning number. In the last 3 weeks, hospitalizations have declined 65% in the Ohio Hospital Association's Northeast region. Now that's Greater Cleveland. They've declined 60% in their East Central region. That would be the Greater Akron-Canton area, and 44% in the Northwest region. Now that includes Toledo. These were the regions of the state that were first hit the hardest. Hospitalizations are declining in other parts of the state, but they're not dropping as quickly in those other parts yet. Despite these improvements, some Ohio hospitals continue to manage very high hospitalizations for COVID-19, but the ongoing decline in hospitalizations is allowing many hospitals to resume services that needed to be postponed during this most recent surge. Due to the continued extraordinary number of COVID-19 cases, especially in the southern half of the state, many hospitals continue to require the support of the Ohio National Guard, even as other hospitals are now able to transition away from Guard support. The Ohio Hospital Association continues to actively partner with us in surge planning to ensure that healthcare services continue to be responsive to the local needs of each and every one of our communities. So we are feeling hopeful as we begin February that better days are ahead. But remember, we are still a very long way from having case levels like those we were seeing in the late spring through the early fall. Our cases per capita are still, as a state, more than 10 times what is considered high in terms of levels of transmission. Now, as we look forward, there's no crystal ball to tell us what will be coming next. COVID-19 is almost certainly here to stay. So now the question for us is, how do we learn to live with it? And at what point have we moved from something that's truly a pandemic to something that's more endemic? And how do we make that transition in the best way?